1840, Doctors Harris and Hayden were teaching actually at the University of Maryland School of Medicine, and they were faculty teaching dentistry. They felt at the time that dentistry wasn't getting the full attention it needed, and so they broke away in 1840 and formed the very first dental college in the world, which was the Baltimore College of Dental Surgery, now the University of Maryland School of Dentistry. So historically we were together. Proud. Yep, very exciting to be a graduate of that program. And I do, in talking with our Dean, Mark Reynolds, last week about this topic, he mentioned several things that are trying to integrate medicine and dentistry together in their curriculum. The first thing is during their first year, their anatomy courses are taught over at the medical school across Baltimore Street on the campus there. So that's one exposure to medical and dental students getting together on campus there. The other thing he mentioned was there is some faculty that work in both schools that go back and forth. We certainly have some dentists, particularly some well-skilled oral surgeons treating oral cancers at our school that are dual degree. They're dentists and physicians. And there's faculty that certainly the medical students need some basic knowledge of what to look for on an examination. So some of the dental school faculty works with the medical school as well. And the third thing he mentioned during their senior year, there is a option for a collaboration over at the medical school for senior dental students in an externship. So that gets them some experience that way, and I'm really excited that this fall I'll be starting an externship with the dental school in specific for geriatric dentistry, giving dental students the opportunity to shadow and dental assist in portable dentistry in long-term care facilities. So it's very exciting. We're doing more and more in this topic.
That's wonderful, because as I say, I've been writing about Aging America for 20 years, and I know at the beginning I certainly didn't hear about dentists going around with portable equipment. Maybe you didn't have the kind of portable equipment that you have now to help you.
Well, it has improved. We've got, say, Aseptico equipment that I have originally used by the military to parachute off equipment to soldiers or villages that might not have access to dental care and provide care. So these are very durable units that have just about everything you need that fit neatly in the back of my car that I can go from facility to facility.
That's wonderful. That's wonderful. I searched the Maryland Dental Association's website, and what's good to see is there are a few options for people who are either disabled or they're financially strapped. And I know many people, I've talked to folks about dental insurance, and if they're upset enough about just our overall health care policies, then they try to add in dental care, because as you know even better than I am sure that very few health policies actually include your dental and your optical, so you have to go out and buy separate policies. And so if you're already in trouble or strapped, it's not like in my hometown. I actually got help at NYU's dental school, but I could just hop on a train. If you're physically disabled or you are too old to be driving because of vision or whatever issue, and it's impossible. There's no mass transit. As a transplanted New Yorker, I can tell you, it's very hard to get to the relatively few resource centers. And so what would you say to colleagues about participating more in the ones that exist and maybe even helping founding more? What would they have to do?
Well, in Maryland, for example, we just last month the governor signed Senate Bill 284, which is the Maryland Medicaid program starting a dental coverage for adults. We do a very good job in Maryland with the CHIP program, the Children's Health Insurance, that all Medicaid children are assigned a home when they sign up in the program. This is your dental home. Feel free to make an appointment. And so now we've got, since the governor signed this bill, we'll be coming out with details on a pilot project, thanks to Senator Mac Middleton in Southern Maryland and Delegate West in Western Maryland, to reinstate at least some basic dental coverage. The details haven't been worked out on that yet, but it's going to be very, very exciting to those with the most need to get some care. As you mentioned, we have other things. Certainly care at the dental school, although not free, is reduced. We also have a donated dental services program run through, as you said, the Maryland State Dental Association, called the Maryland Foundation of Dentistry for the Handicapped. That matches patients with disabilities up with dentists who can provide free care for those that. Yep. So, and then we also have programs like the Mission of Mercy, where we set up usually in an auditorium for 2 days and provide free dental care, no questions asked. We actually have one coming up in Waldorf, July 27th and 28th, and that's the Southern Maryland Mission of Mercy. It's at North Point High School in Waldorf, Maryland, and it's July 27th and 28th.
And to find out more
so they plan to see about 450 patients per day. It's about 900 patients during that time period. So.
And what do our listeners have to do to find out more about it?
I would say visit the Southern Maryland Mission of Mercy or the Maryland Mission of Mercy website, or there may be a link on the Maryland State Dental Association webpage for that.
Okay, and so is it a good thing to check out the American Dental Association and the Maryland Dental Association's websites, and you can find options for when you need help?
Absolutely. There's a couple good sites I refer patients to when they have general questions. Say you're a new mom and you want to know when teeth erupt for your child. There's the Academy of General Dentistry has knowyourteeth.com, where you can print up, access and print up one-page items that might list questions. How do you take care of bad breath, for example? What can be some of the causes? Treatment for periodontal disease. So that's a very, very good website. And also the American Dental Association has under their for the public section information and links to get patient information on dental care as well. That would be ada.org.
Yeah. I heartily recommend folks start with the American Dental Association, especially since this is a podcast, so it can be anywhere. Obviously, try the Maryland Dental Association's website, but I heartily recommend the ADA's because I've worked with other leaders at ADA in getting the word out about a variety of issues, and as Dr. Doring just said, you can find information on all sorts of things. You can find tips. It's not just about how to brush your teeth better. It's about warning signs and all sorts of stuff, right?
Exactly. Good information that would be helpful even for a family member or caregiver of someone who can't take care of their own teeth.
Right. Yeah, that's there are some wonderful adaptations if you're caring for a loved one. As we said earlier, even if it's just a temporary disability, you've got to help a loved one brush his or her teeth. That can get into fun. And the younger they are and they're twisting and turning, or as you mentioned before, if they have Alzheimer's and they feel threatened, they don't remember what this is all about, because that's an issue. We really don't discuss it as much as we need to, and I don't know if the average caregiver, until it absolutely erupts in their face, they really don't know these issues, and that's why you and I and others have been trying to get the word out for many years now about understanding Alzheimer's, about helping as we all get older. I mean, heck, we put the older Americans at 65. Our teeth start going down along with osteoporosis, right?
Correct, yes. Certainly bone density and calcium intake, those are all important factors. Again, that medical-dental connection, knowing the patients as seeing their physician routinely, if they have osteopenia or osteoporosis, that they're getting appropriate treatment. Sometimes, for example, I've had a patient come in and they came in at the wrong time. They came in a day early, or they forgot where their keys to their car were, and I'm concerned that there might be some mental decline. So sometimes we talk to their spouse or their physician to make sure that there's not some early signs of perhaps dementia occurring.
Yeah, it's very hard to keep track of all these things. I'm going to put in, because we're almost down to 3 minutes, believe it or not, I am going to put in an extra word. I think just before you were able to call in, I was mentioning the disaster in Ellicott City and our trying to help people. And we may not think of it as important, but if people have spare dental kits, or you can go to Walmart and Walgreens and all these places in the 99-cent section and pick up extra small things of toothpaste and extra toothbrushes, and find out if there's a way to donate them. I don't know if Maryland Dental or the ADA or other places is helping, but if they haven't started, I urge them to try and help folks in here and Puerto Rico, of course, any other places where people are going to need help regularly with dental care. We got to keep it going, right?
Absolutely. I know the American Dental Association did a lot of aid for Puerto Rico. Many of those dental offices in Puerto Rico were devastated. So to offer them assistance to be able to open back up and see the patients was a great help. And that's happened time and time again for ADA members who have earthquakes, floods, whatever the natural disaster, to get them help. And if that occurs in downtown Ellicott City, I'm sure the American Dental Association will be right there to help their members to get back on their feet so they can start seeing their patients again.
Well, believe it or not, I'm down to 2 minutes, so I'm going to thank Dr. Charles Doring. And Doctor, remind folks, what is the name of your practice? You're in Rockville?
North Bethesda Dental Associates in Rockville, North Bethesda area.
I can't thank you enough, not only for the practice you do there and the teaching at the University of Maryland, but the wonderful extra help you're teaching folks about geriatric dentistry and helping people with all sorts of disabilities. So I thank Dr. Charles Doring, and I'm going to give you a brief reminder. My name is Wendy Myeroff. I am the Biz Partner of Partners in Health and Biz, and we welcome you to our show every week. Gail Dixon, our founder, and the lady who talks more about wellness. She's back next week, so keep checking social media and our webpage and so forth, and you will find more about us. Doctor, I thank you again. I can't thank you enough.
Thank you for the opportunity.
Well, thank you for coming on board. You enjoy the rest of Saturday, folks, and this is Wendy Myeroff. I am also WM Medical Communications, serving Baltimore and all the way